Hi, myself Settlem Amar. Can I know your name and age?
Vishal 22.
Okay, so today I am going to do examination of sensory function and reflexes. So first I am going to do sensory function. Is it okay with you?
Yeah.
Okay. For that I am going to uh, do. I am going to perform sensory pain. Okay. So for that I am going to use cotton swamp. I am going to place it in different areas of your body while you have to close your eyes. Okay, if you feel any pain, say yes. Okay, so close your eyes.
Yeah.
Okay, relax.
Yes. 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 Yes.
Okay, open your eyes. Now I am going to perform superficial tactile sensation. For that I am going to use cotton wisp. So I am going to gently touch on your skin while you have to close your eyes, and if you feel any stimulus, say yes. Okay, close your eyes.
Yes. 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 Yes.
Okay, so now I'm going to do. Okay, so now I'm going to do sensation of vibration. For that I'm going to use a tuning fork with 128 CPS. So I'm going to vibrate on my bony area, and I'm going to place on your digital end of your finger. Do you feel any vibration?
Yes.
Okay. Let me know when it stops.
Stop.
Do you feel any vibration?
Yes.
Okay. Do you feel?
Yes.
Let me know when it stops.
Yes.
Do you feel?
Yes.
Okay. So now I'm going to do. Now I'm going to do position sense or proprioception. For that I'm going to do passive movement of your fingers. You have to tell me which direction I am pointing. Okay.
Up. Down. 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 Up. Down.
Now I'm going to do lower extremities while you have to close your eyes. Okay.
Up. Down. Up. Down. Up. Down. Up. Down. Up. Down. Up. Down.
Okay. So now I'm going to perform discrimination forms of sensation. So first is sense of discrimination. For that I'm going to place some objects on your hand. You have to close your eyes and identify what is that. Okay. So close your eyes. Can you bring your both hand in front? So I'm going to place something. Identify it.
Coin.
Okay. So now I'm going to place some other object in your hand. Identify it.
Coin.
Okay. Is a small coin or big coin?
Big.
Okay. Open your eyes. So now I am going to perform 2-point discrimination. For that I am going to use a 2-pointed pin. So I am going to pin this on your finger. You have to close your eyes and identify whether it's 1-pointed or 2-point.
Okay. 1, 2, 1, 2, 2,
Okay.
2, 1.
Okay. Next. Now I am going to perform a graphesthesia. For that I am going to use a Okay. So now I am going to write some big letters on your palm. So close your eyes and tell me what did I write.
5, 8, 10.
Okay. So now double extension. Okay. So for double extension, you have to close your eyes and tell me if you feel the stimulus on both sides or single. Okay. So close your eyes.
Single. Both. Single. Single. Both. Both.
Okay. Now open your eyes. Now I am going to do point localization. So for this I will touch your skin and you have to open your eyes and identify where I touch. Okay. So close your eyes. Now open your eyes and tell me where did I touch. Okay. Close your eyes. Open. Okay. Close. Okay. So now we are done with sensory function. Okay. Now I am going to check for reflexes. First, bicep reflex. For that I am going to place your hand in a relaxed position, palm down. I am going to place my finger at a bicep tendon and going to hit with a reflex hammer briskly on my finger. Check for constriction of bicep muscle and flexion of forearm. Now I am going to check for reflex of tricep. I am going to place elbow around your chest and going to hit above 2 to 3 inches above the elbow briskly. So look for constriction of tricep muscle and extension of elbow. Now I am going to check for reflexes of brachioradialis. So place your hand in a supination position and going to hit 2 to 3 above inches of wrist on radius. Okay. So look for constriction of supination and flexion of forearm. Now I am going to check for knee reflexes. So in a flexion position I am going to look for patellar tendon and going to hit with reflex hammer and look for any reflex. Okay. So look for constriction of quadricep muscle and extension of knee. Okay. So now I am going to check for ankle reflex. So I am going to dorsiflex the ankle. I am going to hit on ankle tendon. Okay. So look for plantar extension. So if you feel your ankle hyperactive, so do ankle colonies. So flex the leg slightly and do flexion and dorsiflexion and plantar flexion, and do fix at a plantar dorsiflexion. Can do it with the other leg. Plantar dorsiflexion and plantar flexion, then fix at dorsiflexion. Okay. Now plantar reflex. So for that, can you bring your leg up? Okay. So now I am going to gently stimulate the leg and look for plantar flexion. Okay. Relax. Okay. So pathological sign of plantar reflex. For this, like when you give stimulus, if patient's big toe goes back, it is a sign of positive sign for Burbanski's sign. Okay, the next is cutaneous stimulation reflex. So I'm going to use cotton swab for this. Constriction of abdominal muscle. Okay, so now meningeal sign. So for this I am going to pull the head and try to touch the chin to the chest. While doing this, hip and knee should be in relaxed position. If hip and knee is in flexion, there is a positive sign for Brudzinski's sign. So next is okay. So now I am going to flex your knee and straight upward extension. Flex your knee and straight upward extension. If while doing you have pain and resistance, that is positive sign for Krenning's sign. So next is straight upward hip raise. If you feel, it's a positive sign for straight leg test. So we are done with reflexes and sensory examination. Thank you for your cooperation. You can relax now.
Okay.